providers and health professionals that you are and what you can actually do. So if you would describe what your relationship is, and we'll start obviously with the young lady, um, how you describe the services that you provide and where the opiate addicts, addiction, and the Black community come together, Dr. King.
Absolutely. Thank you so much. It is so exciting to be here and share this platform with wonderful providers here in Minneapolis. But yes, I am Dr. King and I provide therapy throughout the Twin Cities. I do quite a few things throughout the Twin Cities. But when it comes to services related to the Black community and opiates, I really deal with like the other side of it. So you come across those who are struggling with the addiction piece, but my clients are usually the ones whose family members have overdosed, have died, or they are trying to get their loved ones into therapy. So I'm usually seeing the residue and the aftermath of how opiates affect the family and the outcomes and the agony of trying to keep, your support system together. And that's where I really provide the support.
That's wonderful. Mr. Green.
Hi, hi, I'm Peter Green, and I'm the diversity director at New Way Treatment Center, a substance abuse and mental health provider in the Twin Cities here and in surrounding areas of Minnesota. And we not only serve the opiate population, but we also serve many other substance abuse and mental health people. I am the diversity director, and like I said, what I do is I see all clients, male and female, all inclusive, individually. And I also try and set up for family sessions when I get a chance to. So I think I feel honored to be here as a guest to try and help out my community.
You ain't no trying here. We not the people that try don't show up on this camera. I mean, we're not even doing the try. I mean,
right.
This ain't the moment to be humble when everybody is posting whatever they can, and our community needs to know the dedication. Because I tell you, it's not easy. It's straight up burnout. I mean, to literally be going where every time you're an ambulance chaser and it's a real full impact, mental health, the whole thing. So anybody out there, just understand if someone says that they're dealing with counselors and clients, or even the aftermath of what opiate she was calling residue, or I would just say the whole entire ecosystem of recovery. And that's where it would come. Mark Jonigan, your entire organization is a safe space. Why don't you describe what it is when you think of the two individuals here and how opiates and your particular organization at this moment is continuing to provide Black opiates the counsel, the pipeline, the connections to the entire ecosystem of Minnesota.
Yeah. One of the things I would like to talk about is the fact that, Peter Green, who also works with us at Twin Cities Recovery Project, providing oversight for peer recovery specialists, has been a great pipeline to support individuals who are transitioning out of treatment, right? Because that's the importance of the whole peer recovery model, is that when an individual leaves treatment, it is highly important that they get connected to the right population of individuals in order to create the lifestyles that they are seeking and desiring, right? And so at the Twin Cities Recovery Project, it has been our goal to assist those individuals initially by providing social wellness, right? By creating opportunities for them to have a place to go on Friday and Saturday nights, right? To play cards and dominoes and shoot pool and dance, right? Learning how to live life all over again. If you've been using drugs for 20 plus years, 15 years, what does it look like having a good time, right? And so we have been providing that space for 4 years now. And throughout the daytime, we have a space where individuals can come watch movies, right? They could come and work in our computer lab and have a peer recovery coach assist them with an application, um, uh, looking for jobs, building a resume. And most of all, our recovery coaches are resource brokers. So they know about every resource there is for an individual to succeed or get to the next level or meet the current need that they have.
I love that. Give me an idea, Dr. King, if you would, on when we think about Black opiate addiction in Minnesota, what are the three things that most families have to put back together and why they seek your support and professional services?
So when we're thinking about Black families and we're thinking about the opiate crisis that has also hit us, three things that they have to put together is one, the stereotype. There's a lot of shame and guilt when it comes to drug use in our communities, and there's different hierarchies of drugs, right? So we've always heard, like, your uncle who drinks alcohol, oh, he just likes to have his nightly drink. But we don't ever hear the other side of, yeah, my cousin uses opiates and possibly heroin. That's the hush hush. So being able to have families that can openly discuss that this is an issue is one of the first things that, I'm helping to facilitate. The other piece is the trusting process. So being able to trust each other in the family unit is huge. When you get into addiction, it takes a lot of lying, it takes a lot of covering, it takes a lot of hiding. And so now the person who is, the suffering addict, they're trying to, get back into the family. We now have to create the circle of trust again. And that takes a series of steps, right? And then last but not least, and there's so many more things that come into rebuilding the family unit. But the last piece is also understanding and talking to their kids and helping to educate the children, of what's happening. I think, no, I know within the African American community, we work under the guise of what happens in this house stays in this house. And so we don't really reach out. We don't really tell our stories. We really don't let people know what's happening with us. And children learn that piece. And so helping children to understand, what they're experiencing, what they're witnessing, and being able to, say that are part of the barriers and part of the pieces that I help to utilize when helping the family rebuild. Because without those pieces, sobriety is great. But if you don't feel like you can be honest, if you don't feel like there's that stigma, if you don't feel like you can talk honestly to people, then you're still stuck in the bubble of isolation.
Thank you so much. That was very important for people to understand, at least those three important. I know that we're kind of distilling everything down, but I want to ask a very similar question. When you're at the Twin Cities Recovery Project, Mr. Green, and you're actually bringing, what are the three things that a person coming out of treatment needs to understand about having and establishing a relationship with peer-to-peer type counseling and intervention of their new lifestyle?
I think first and foremost is communication. And like Dr. King said too, we do run in this, or we're used to running in this, how should I say, this community of secrecy. And so if we can start with the communication level, and then we can build that trust and that comfortability, a sense of comfortability and camaraderie, I think our chances on long-term recovery are very likable. It's a likable chance. But what happens, unfortunately, with the COVID-19 times right now, we go further back into our shells or further back into our caves, and we go back to what we used to doing, and that's living in secrecy. That's what I found. And then knowing that, there's a lot of people that are continuing to use.
So when you think about peers, because I know at the Twin Cities Recovery Project, peers, people are really learning because people may not have an understanding of how to get a sponsor, literally understanding what it is to be able to claim and accept the fact that they are opiate addicts or say they're heroin addicts. So in sharing that peer-to-peer process is kind of important because they may not have known anybody, may not have a sponsor, may not have any insight on how to call, share their feelings. What are those peer services when you see it and you're thinking you and Mr. Green, Mark, are coming together? What are the three things that you want somebody to know? Because I think it's a hole in our community in terms of the ecosystem is they don't know what those things are that a person's having to learn from some other person who's in recovery.
The first thing that I think is highly important in regards to delivering peer support services is that the individual has the opportunity to connect with someone who's been where they've been, right? So therefore, it lays the foundation of equality opposed to, and that's why I like the language peer, right? So it lays the foundation of equality that I'm not superior to you, right? I'm here to support you, and so that comes into what Dr. King and Peter both said: relationships, right? Because when you can develop, because my motto is, man, you can't begin to impact an individual's life until you begin to build an authentic relationship with them. And in building authentic relationship, that means that I'm going to have to tell them some things about me, right? And I train my staff that this isn't clinical, so we don't have to hide the parts of our life that was ugly. We need to be able to expose those parts, because it's when I'm able to talk to individuals and tell them what I've truly experienced that they get a sense of hope, right? That if you've been through that, you've been to prison 6 times, you was addicted to crack cocaine for 25 years, over 25 years, and you've been to jail uncountable times. Your son was murdered due to you not being the father that you could have been. When people begin to hear the horrible side of what addiction, presented in my life, and then they see where I'm at now, then it gives them a sense of hope that, man, this, the authenticity. I'm not trying to be superior to you. I'm not trying to be a dictator to you. I just want to serve you, support you, and help you to become the best that you can be. And that's what I teach my peer recovery coaches.
Dr. King, when a family is learning the same kind of question, what do they have to do? What are the other services that they need to begin to make themselves aware of?
Absolutely. Other services that a family can do, because recovery is a selfish program, right? You have to, the recovering addict has to really focus on themselves. Like, the motivation can be for your kids and your wife, but that's not the thing that keeps you sober. And so while that person is getting themselves together, I encourage the family to participate in support groups. A lot of that is Al-Anon. And also being able to go, sometimes you can show up to an open meeting with your loved one to see what does the sharing experience look like. But really, with the Al-Anon piece, you're working with other family members. Some family members that came from households of alcoholism or drug addiction, wives who are also, or husbands who are also trying to figure out, what do I do while they're trying to figure out to get sober? Because as Mark is saying, all the avenues that drug addiction takes you down, it's not an individual suffering. It's a whole system suffering. And so your children suffer, your mom suffers, your everybody you love suffers, and not even just watching you, but sometimes there is, taking of property, getting you out of jail, spending their resources trying to keep you, having sent you to sobriety programs 10, 20 times, you know? And so now the family, and we'll just say for the sake of a wife or a husband, having gone through that, you've built some resentment along the way. You know, I've been sitting here making sure that you've been okay. And, you know, you've practically, it feels like you've destroyed our family, but I love us and I want to stay with us. So how do I do that and support you? And I don't sink too. So I really encourage families to participate in Al-Anon, do individual therapy, and build healthy support networks as well.
You know, Peter, when I'm listening to Dr. King, it is very obvious that there are exchanges that people have to be able to build when you're talking about trust. When you're an opiate addict or you're an addict just entering recovery, and somebody says, well, I want you to know about playmates, playthings, play places. When you're talking with peers, because I want to be very granular, because when you're talking to a peer, you're trying to explain something to him about places. What is this conversation and new language that a person literally needs to go, like, stay out of the bluff? You know, you're sitting back at playground. Can you share what and how you allow them to build language and even understanding what that means?
Thank you. Some of my colleagues won't agree with me, but I'm one who comes from a school of self-disclosure, but I have to do it with discretion. And that's how I'm able to get past the barrier of distrust, because I remember that. I mean, I'm not going to just trust anybody with a lot of the stuff that I've had to do and things that I've done. But in order for me to get past that wall, I have to self-disclose some things of my personal experiences with my people. And the peer recovery specialists that I get to work with here at Twin City Recovery, we're good at doing that. We do that well. But like I said, we don't disclose everything. And then while we do that, is we're allowing the walls to come down, and they can see over and say, yeah, okay, I trust this person. I can work with this person. And I think this person, as we would probably say in the street, oh, he's cool or she's cool. And that's where we want to be. We want to get to the point where they can trust us, and we can also allow them, and then they could hear us too. They can hear us, and when we suggest, hey, you might want to see if we can get a family member to come in. Maybe we can all three get on the same yoke and work at this thing together. And then they buy in. That's my approach, and I've tried to help other people with that approach, and they see it and it works. So we keep doing that. And then to also have, because the myth or the stigma, particularly with Suboxone or methamphetamine, I mean, not methamphetamine, but methadone, people, they really don't want to buy that. How am I clean and sober if I'm still using an opiate, but that's just, that they are changing, because we have to give them the approach with the harm reduction. They're not robbing banks, they're not robbing their grandma, so we are making progress, but it's little grains of progress is better than no grains at all. I hope I answered your question.
But you with family, Brother Green, so it ain't about answering my question. It's giving people the knowledge and the love. This ain't about a perfect answer. If somebody working for a perfect answer, they need a perfect shot for staying clean. I don't know that comes there, because you're going to run into a brick wall. Life is going to send you a curveball, no matter if you got 50 years clean. They don't care. Life does not care. Scott Peck said life is difficult from the start and the road less traveled. So, you said a lot. I mean, you literally, in terms of people that maybe they didn't get it, but clearly when it comes to cultural identity and treatment, and you're saying to someone, we want harm reduction for your family because we want you to be able to understand that they are addicted to heroin. We're going to have to give them something to move their body from one thing to another until they can actually begin to process through and to mitigate the feelings that they're having, the withdrawals. And so I think culturally, This isn't a movie. This is real life.
Hmm.
I think that you said a lot, because culturally, this is why Mark and the Twin Cities Recovery Project is here to disclose to communities. This is what your family member needs to understand is a treatment protocol. It's not the only one, but do not get mad when they have to go pick up methadone, when their methadone has to be there. It's a process. And if you love that person and accept that person, this is one of the treatment protocol that is available so that you will understand that there is dignity in recovery. I think part of what the Twin City Recovery Project is great at doing is bringing dignity, respect to the community of recovering individuals in Minnesota and around the world. I mean, that is the primary purpose when you think of Twin City Recovery Project, a phenomenal leader like Mark, putting together a protocol and a practice where it's a welcome mat versus a shaming blanket. You know, nobody wants to put out a shaming blanket. And I mean, we're in the middle of a pandemic. And so when you already got barriers of entry to recovery and depression, talk about isolation, y'all the only people that I've had in my house today. You know, so I think even figuring out how to have a holistic approach, because, and that's my next question when we talk about it, Dr. King, people now, and obviously the Twin Cities Recovery Project being on the forefront there in MSP, really understand that there has to be a holistic treatment protocol. You can't do treatment and not know my teeth are hurting. So if I need something for the pain and you know that I'm depressed, but you just want to talk about the dope today, why is a holistic protocol, treatment plan, treatment service so important to individuals who are suffering from addiction to opiates, for the family and the individual who is literally working to change their life around?
Absolutely. A holistic approach is important for the recovering person, because when you go through addiction, there's so many parts of your life that just start to deteriorate. So we're not just talking the financial piece, we're talking finances, we're talking about housing, we're talking about occupation, we're talking about families, relationships, your health. Everything becomes neglected because drugs and alcohol puts you in the zone where you can't see anything else. It puts you in drive to just go get the next high. And so when you finally come up out of that fog, now you're starting to look around and it's like the tornado, and you're looking around and you're seeing like everything has kind of fallen apart. You know, you're homeless now, you don't have a job, you've messed up all these relationships. So when we're looking at the holistic approach, like you said, it's not just going to a recovery program, it's also getting connected with a primary care doctor. And because we understand that drugs and alcohol can have a severe effect on your mental health, now you probably need to get on some psychotropic meds. Not only did you go through your addiction, but there was probably, you know, you're not taking care of yourself. So now you probably have high hypertension. So now you got to go get hypertension medication. So you have to look at all areas, even the spiritual piece, because when you are going through your process, the depletion of feeling like yourself has occurred. And so now you're fighting your way to feel like that dignity, that strength, your self-esteem, getting rid of or moving through the shame and the agony of some of the things you might have done in your addiction. And so holistically, you want to be able to explore all those areas, and it can be scary. So that's why usually when people get connected with me, I'm making sure that they have their primary care doctor. They're going, if church is what you do, get in, back in touch with your pastor, with your family, your children, helping to write, letters in case if you have to say some apologies and make some amends, right? And some of the steps of the 12 steps talks about that. And so it's not just one thing over the other. And that's where some, recovering people want to do. They don't want to touch that area yet. But I always remind them, you're looking to become a whole person, and that's going to take you doing a gut-wrenchingly honest inventory of yourself and where those gaps have to be filled. And it's okay. We can do it together. We can do it slowly. But one thing about it, two things for sure, it has to be done.
Thank you. Beautiful. Mr. Green, same question for those individuals who now need to understand, even from a cultural treatment standpoint, peer, holistic, what's the holistic value that you see being developed there in MSP at this phenomenal program that you bring together with the peers? How do we holistically approach what they're doing?
I have to go back with my history of first meeting Mark, having the pleasure and honor of meeting Mark, and our beginnings of this talk when we were talking about doing, when he was talking about doing this, I'm so grateful that he was able, or that he found me through a mutual friend of ours, and I was ready to take off because it was a service that was needed so bad, and we had one here in the cities a few years ago, and it was around for almost 40 years, but for funds or whatever reason, it was dispersed and dissolved. And so when he came with that ideal, it took me back to where I worked, and I worked for that nonprofit organization. And so what was happening with that organization, and then what Mark and I talked about, is that sure, we can get the client in treatment, but what is the client doing after treatment? And that was the question. And we had to build a bridge, and I'm so glad that I was a part of building this bridge with Mark. And so what happens when the client's out of treatment? Where does he go? So we wanted to have a peer support specialist for a person waiting on a person coming out of treatment, because a lot of the treatment centers right now that we're working with, that I've had the pleasure of working with, they don't follow the client after treatment. And so that's one of the good things about Twin City Recovery Project, because we can catch that person when they're leaving that door so they don't fall off. And that's where a lot of people were falling off. And then so what was happening with Mark and I, and came up with some other ideas, is we talked about it. He came up with things where it was like a wraparound service. And that wanted to include us being able to make referrals to our Black communities, our mental health resources in the Black community. So we found that. I found one, just found it on the internet. All I did was typed in Black mental health providers in St. Paul, Minneapolis, and bam, all kind of things came up. It's just that simple. But they don't know how to do that, or they don't, because they're so far removed. The drugs have removed them from reality for so long, and it's like, can you imagine coming out of a cave for 20 years and seeing that bright light? It would be like blinding. And so I'm fortunate enough to be able to have a source for the people that's coming out of treatment into the community. And I think that that's less threatening otherwise, because there's some people that if they're getting referred to places like go see a mental health therapist in the community, it's like, okay, well, where am I supposed to go? And that's threatening and that's scary. And they would just rather stay in that cave than to make a step forward. So I'm glad to be here where I can take an arm or take a hand and say, come on, let's go, and walk with them to that. And it's just as simple as coming up to Twin City Recovery Project in most cases.
When you think about that, the Twin Cities Recovery Project, bringing those realities so that there are safe spaces, and mental health is not assumed to be already in good shape. Mark, you have become a resource so that individuals can be honest. How is mental health playing a role right now here in recovery with opiates and the pandemic, given that many people are isolated, alone, and unemployed, discriminated against, health disparities, and a degree, and most people won't talk about it, paranoia?
Playing a huge role across culturally. When you think about how this pandemic has impacted African Americans, and even understanding that there are 4 million or 4 million whites in Minnesota, and only about 362,000 blacks. And when we begin to talk about the health disparities have become very evident now, right, throughout this epidemic, right? Because those are huge disparities in numbers, blacks make up about 20% of those who have been hospitalized for COVID-19, right? And nationally, we make up 8% of population, but 55% of African American community members have contracted COVID-19. And so then you talk about how do we, so for instance, I live in North Minneapolis, and there's a liquor store there on the corner of Broadway and Lindale. And I mean, not every other day throughout this pandemic. I'm talking about every day, and I'm not talking about at a certain part of the day. I'm talking about all day. There's at least 100 to 200 young individuals who have been congregating, right? And so my goal initially was to try to find a mobile site to bring to that area where individuals can be tested, because there has to be a huge amount of individuals who have contracted COVID-19, but they're unaware, right? And so initially when COVID really hit, it really made me think, and I said, wow, this is going to be, devastating, because COVID presents the total opposite of what recovery represents. Connecting, you know, getting mental health support so that you can fight your depression. And so when we talk about not associating with people, not coming to one another's houses, not meeting at the recovery project, um, um, uh, being all alone in your thoughts that you've been fighting throughout this process, especially for people who are super new in recovery, man, they left to hang out dry, right? And so, man, my staff was adamant about, man, how we can use every precaution necessary to come to work. When I told them they couldn't come to work, they were upset. That's what let me know. I said, wow, I love this. When you got people who don't want to be at home from work and they want to come to work, and so we initially started connecting every morning on Zoom, having morning meditation as a staff, talking about our challenges, meeting once a week to have lunch, and it was highly necessary. And so it has presented a lot of challenges. I work with an organization, PPL, and just a part of one of their community meetings the end of last month or the beginning of this month, and the residents there are saddened by the fact that they haven't been able to connect to individuals, and that's all they talked about was depression and mental health challenges. But yeah, so it's been crucial. It's crucial. Yeah.
So thank you, Mark. Dr. King, many people don't know how to establish or forge new relationships with a counselor, or Black healthcare professionals. What are some, if you would, just give people 3 or 4 ways to just begin to establish? Because if you say, "Oh, I need a health professional," but how do they pick one, go forward, and begin at least establishing both mental health and physical health professionals? They're in Minneapolis. to serve those opiate addicts today and their families.
Absolutely. So, three things that a person can do to start to seek help and stick with help. I would say the first thing is, ask around. I ask around. So, start, like Peter was saying, your aftercare program. Once you finish your recovery program and you go into aftercare, a lot of time the aftercare counselors know other professionals that can link you with, further mental health services, right? Starting there. The other thing they can do is, I really encourage my clients, come in with a sense of curiosity, come in just wondering what other people have been saying. You don't have to agree with everything, but just come in with an open mind to just hear and possibly explore some of those things that you may agree with, you may not agree with, or what we say, don't throw the baby out with the bathwater, right? You don't have to disregard everything, but just come in with curiosity to know, what is this thing? And then the third piece, I would say, not every therapist you come across is going to be a great fit. And that's okay. That is absolutely okay. Just because you didn't connect with the first one doesn't mean that you failed at getting help. The fact that you continue to search and you continue to try, that is part of the recovery, because our relapse instincts are, once it doesn't work, to heck with it. I'm done. I tried, it didn't work. But when you continue to show up, even when you don't want to, that is recovery. So for my clients that say, I'll ask them during the intake process, I'll say, how many therapists have you been to? Sometimes they'll say none. And sometimes they'll say, you're my fourth one. And I'll say, well, I hope this is it, but great job for continuing to search and not giving up. Well, how can I help you? So, just making sure that you're asking around, and start with your close support networks, making sure you're coming in with a sense of curiosity. And last but not least, find it and never cease when it doesn't work out, but just keep going until it does.
Peter, you obviously are right there at the forefront. Thank you very much, Dr. King. You are right there when a person's establishing trust, forging a new relationship with a counselor, even identifying what role a counselor plays on getting a person prepared. Somebody's never been in a room. They've never had to have and talk and be. Take a family member, those who are watching, into kind of some of the group sessions with a few titles that they're going to be learning how to share about themselves openly and out loud, and why.
In an initial contact with a person, hopefully I could do it with a client and their family members, such as a spouse particularly. I would ask them or him or her, if they would do one thing first and foremost. And, because what I would ask them is while we're doing this, will you look for the similarities, not the differences? That's first and foremost. Because if we can find some of the similarities and not the differences, that's the first road to the mending, I believe. That's what I want to do. And what I found in our Black community, or in our opiate communities, I found that fear tends to scatter the herd instead of gathering and unifying. That's what I've seen. And that's what I'll try and work toward, mending instead of continuing to part. And if I can get them to buy into that, and then I can see them being open to being better educated in a language that they understand, not a language that's going over their heads. And I think that that's what happens, particularly in the Black community. And what I've found with myself and other people too, I'm too proud to say, hey, I don't understand that. And then you want to let them know that, yeah, stop me. When you don't get it, stop me and let me explain it to you. But some people would take that as a person being rebellious. And I want them to know that I ain't looking at them like that. I'm not coming from a holier than thou standpoint. I want to come to them where they come to me at their level. And that's a hard task for some of the particular new therapists that's coming in, I believe, to find that I'm not better and let them know that I'm not better than you. We're trying to work on this together. And so,
and just the idea of having a counselor like yourself, being able to establish a relationship, for many people, it's a quick process. You may be coming out of prison, they never dealt with your addiction, you're still addicted when you get out. So all of a sudden now I'm addicted, I'm back using again, I go to treatment, I meet you, and now I'm still confused because I've never met Mark. How important is it that the counselors socialize and actually make it to the Twin Cities Recovery Project? Because to me, it seems like if you don't make it to the Recovery Project, you can just skip out and be back in your playgrounds.
I think Dr. King said it earlier too. And Dr. King, I commend you on that, because what's happened here, particularly in Minnesota, what I found is because of insurance companies not being able to bill for aftercare. So we are kind of eliminating that phrase particularly. And I think it needs to be implemented again, because again, everybody's not going to come to Twin City Recovery Center, like you said, Mr. Steve. And so if we can offer them something like maybe a phrase like continuum care, then insurance people may say, oh, okay, well, we can find money for that. I mean, and that's what it really boils down to at the end. At the end of the day, it's about the money and the funding. Unfortunately, money.
I just wanted the public to know 28 days is, if you've already been using for 5, 10, 20 years, 28 days does not begin to scratch the surface of being able to get the very lifestyle change that the Twin Cities Recovery Project provides individuals, because it is all about a lifestyle change. That was very much why I keep saying that. Mark, can you share and give some insight on that?
Definitely. I think it's highly important for us. We as the African American community are challenged with a couple things. We are challenged, and we have an enemy in regards to how we're provided healthcare, we're provided resources, but we're also an enemy to our own community. And Peter talked about that a little bit. And it's very, very important for us to begin as a community to begin to educate our community how substances has affected our community as a whole, but not just that it has affected it, but where and how did it become a gateway, right, to be able to affect our community, right? So we don't know the hows and the whys, then we continue to repeat the same cycles, right? And so I think it's important for us as Black leaders to begin to rally together and partner with doctors and physicians. And so when I think about that, I'm working with a neuroscience doctor at the University of Minnesota who studies the brain, right? And how drugs affect the brain. And so it's really important for us to be able to send messages to over and over and over to our community that this isn't a moral dilemma, right? This isn't just because this person is a bad person that he chooses to use drugs, right? There are maybe some cases where people just want to do something, but in most cases, we know people are trying to escape reality, right? The reality of what? The reality of growing up in poverty, the reality of being a survivor of sexual abuse, the reality of being a survivor of physical abuse, right? The reality of, you know, waking up and not having a meal, right? Don't know where your next meal is going to come from, because your parents are addicted to substances. And so all of their finances are going to the drug dealer opposed to the household. And you talk about this generation that we see that are out of control. It's not because it's their fault. It's because they have been impacted in such a way that they have been surviving on their own, right? It's not their fault. In most cases, people just don't become the way they are just because they want to be the way they are. It's because of the conditions that they have been raised in. And so, you know, I like to say this, that some of the things that we have been determining as best practice that has been considered best practice for the wider community is not best practice for the African American community. So my goal is to create these partnerships with doctors to be able to do research on our own community to find out how it affects us and how we can respond to it, right? Because it might help white people best practices, right? But they may not have been affected, or I know they have not been affected like most of the African American community has been affected. So those practices don't work. It's going to be very challenging to connect a young African American male to be able to be open to receiving services to an older white male who possibly is just practicing clinical, but has never had an experience of substance use disorder. There is no connection there. And people thrive and they recover off a connection, right? So I'll stop there.
You know, for Black opiate addiction, there are cultural nuances. And I'm sure that cultural nuances as it relates to recovery, Dr. King, can you share just some cultural insights? I know Mark was talking about them, but as a counselor and obviously doctor, a therapist, what are you encountering culturally that, you know, just being an MSP, you're alone, you're isolated, there are not a lot of Black peers, you know, you don't feel the level of success. It's already proven that y'all are behind in education, because when you talked about that, role models are not obvious or not apparent. Actually, they're pretty oblique when you think about, you know, if you don't know somebody. I mean, I graduated from Morehouse, so clearly when I go there, I already have a group of individuals that are there. I go there, there's Clark. So HBU just creates a whole new network, so I'm already plugged when I come into a city. There are cultural nuances that opiate addicts who are Black, who have created a situation in their mind frame, but not because of them. Basically, these are systemic. I don't want people to ever imagine that this isn't systemic, economic, financial, emotional deprivation in MSP. Because it is very difficult to imagine that you're African American, you're Black, you've got 40 Fortune 500, and yet each one of those organizations, not one of them is led by a Black CEO. So that is very depressing when they see the lack of accomplishment by not one generation, but several generations in their face. What are you seeing, Dr. King, culturally, and how does that impact their self-esteem, their courage to be able to overcome, and to believe that they can, given what they see once they walk outside your door? And George Floyd did not give the exception to the society. He only amplified the truth.
Absolutely. Man, you know, I'm not originally from Minneapolis. I'm originally from Birmingham, Alabama. And I can definitely say that just as a professional with access to resources, it was a culture shock to me. I struggled the first 4 or 5 years when I got up here because there aren't many people. there aren't many people that you can look around who are in places to help understand your story, to help you change it around. 90, we'll say 85% of the systems here are white owned and led. And you'll see that the services that they provide are white led, but their clients are Black based. Okay. So if I'm an opiate addict, and I'm looking for help, I'm going to the people that set up a system to, one, not understand me, two, not put me in a position to be where they are, and three, just in the framework on how we have written policies, I'm having to go seek help from people who have based their lives on keeping me oppressed, and they are my only source of help. It not only becomes depressing, but you start to feel as if, what's the point? What's the point of recovery? And then the other piece of that too is white America has labeled the opioid crisis as a white crisis. This is a white people's issue. And the reality is that drugs and substances and all of that is a human existence issue. As long as we are living and we are suffering the way we suffer, some of us are able to cope, and some of us need other things to make us feel different because it's hard to cope. But as long as we have the narrative that it's a white issue, and even within our own culture, that that's not what we do, then it makes it hard to even seek out the help. That it's even hard to just say, I'm addicted to pills. But we're seeing it happening overall, like in higher numbers, but the media doesn't report that. The call to action, the funding that has been provided is not going to us. It's not going to us. In fact, even when, even when we're adamantly really seeking out services. So say, for instance, you get into a major car accident and you hurt your back and you need some pain pills. If you're coming to any of the clinics, a lot of the clinics, because you're African American, won't even prescribe you the opiates. They won't even give them to you when you need them medically. So now, because I can't get them from the professional, I'm going to go to the streets, which now puts me at risk. So even the stigma of getting opiates for what it was designed for, which was to help us medically, is still denied to us because there's already the stigma that you're just going to abuse it, use it, or sell it because that's what you've done before. So there's so many barriers when it comes to addressing this issue, but it has to start with us normalizing that, once again, drugs is a human issue. It's not a black, white, indigenous, it's a human issue. And as long as it's out there and it's available, it is for anybody's taking, and we have to approach it accordingly, without the stigma, without the shame, without the guilt, and without this belongs to them, but not to us. It belongs to all of us.
Yeah. We've got a question mark if you look in the chat for me. The new lens is very important. Can you share how it is important so that the lens begins to be Black? I think you see the question mark. Melinda, we love you. Appreciate the question in.
Continuing to have platforms like Rolling Out. Continuing, it's very important not to just have these conversations. I was talking to Dr. King on yesterday, but we have to create a movement out of this. We can't just have a conversation and then just for the sake that Mark Johnigan is on a platform. It ain't about that. It's about how can we connect as a community of leaders so that we can, first we gotta quit working against each other, right? And it might just start with me, Peter, Dr. King, and some of the others that we have had on the show the last 3 weeks, because we're moving into now hosting our call to action conference. that's going to be October the 23rd, addressing racial disparities in regards to opioid epidemics in Minnesota, right, and nationally. So we'll be having national speakers. So these are different ways that we're going to continue to have these real conversations, and not be so to speak Minnesota nice. Um, like Dr. Aja said, it is a human experience. It's a human thing, and I talk about that. This ain't a black or white. Drugs, trauma, there might not be the same trauma, but trauma is trauma when it comes to being a human being. And so that's why we notice that, drugs affect all cultures. But the disappointing part about it is that when the crack epidemic hit and devastated the African American community, we didn't see these supports. Right? We didn't see legislation change laws. Yeah, we saw them change laws, but the laws were changed to put a man in prison for a piece of crack cocaine for 10 and 20 years. Right? So we saw laws change for the bad. And when we saw commercials, we didn't see white people in their houses and in their suburb smoking crack. They only showed the black people in alleys and and doing all of this stuff, but they didn't talk about the ones who were trafficking major amounts of cocaine that turns into crack. Right? All it takes is baking soda. Right? So these are the injustices that we have to continue to bring to the forefront. And then I believe it's highly important to build cross-cultural relationships. It's important. If we as a nation are going to heal, first we have to have those who are not affected like we are affected to be honest enough to say that and be willing to offer a helping hand. Right?
I want to thank you all. I think it's really important what has been said. I think Melinda controlling the narrative and creating a new narrative. And I think that's what the Twin Cities Recovery Project has done with this series. I'm sure we'll continue it moving forward. But as it relates to Black opiate addiction in Minnesota, Mark, congratulations. You've done a phenomenal job at the Twin Cities Recovery Project, talking about the disparity as it relates to Blacks in Minnesota and controlling and creating a very new, healthy narrative for opiate addicts and addiction and their survival in Minnesota. I want to thank you all. I want to thank Dr. King. I want to thank Mr. Green. And of course, the Twin Cities CEO, Mark Jonigan, for this phenomenal Health IQ, Minnesota and Black recovery and the health system. Here is what we'd like to say is thank you all. Thanks to families and friends, and let's create a healthier narrative as it relates to Blacks, opiates in Minnesota. I'm Munson Steed, and thank you for tuning in to Health IQ.